My name is Jake DeLongwero. I've been in a wheelchair for 10 years and I'm paralyzed waist down due to a spinal cord injury. And what brought me to the hospital was, as you know, in a wheelchair, you have a lot of pressure. And if you don't manage your pressure right, you will get a wound and you will have to come to wound care. So when my sore wasn't healing for the first the first 3 months, it really took a toll on my mental health, right? Because it's kind of hard to see yourself doing everything you can, relieving pressure, changing the bandage on your own, and then you see it's not healing. I feel like that would take a toll on anybody. But coming to wound care and the things they've taught me, the things that they've showed me has changed my life a lot.
Hello, my name is Dr. Edna Acuna and I'm the Medical Director of the Wound Care Clinic at GRMC. In our clinic, we do treat chronic wounds. Chronic wounds do not follow a predictable or expected healing pathway, and it could last for years or months. Jake came to the clinic at one time. He's a young guy who's previously very healthy, but he had an accident and became a paraplegic, and because of that, he's been always on his wheelchair. And inevitably, he developed some kind of a pressure ulcer.
So with my previous doctor, I saw him the first time I knew. It looked like it was kind of like a scratch. Then I saw him the second time and the third time and it just wasn't getting better. And I was changing my bandage twice a day. I was relieving pressure. I was doing everything I could for it to get better and it just wasn't getting better.
The thing that I really want to emphasize is that in the healing pathway of chronic wounds, it takes both the patient and the clinician to work together and assume this predictable goal of complete healing. And so this is what I have explained to Jake, that with the protocol that we have introduced to him, he has to be very compliant and follow it as well as we do with our protocol.
So my first impression being referred to the wound care team was I'm finally going to a wound specialist, someone that specializes in wounds. And one thing I can tell you about the wound center is that when I entered, the energy they give off, the hope they give you, it really changes your perspective as a patient. It actually gives you hope. It actually makes you go home thinking that it's gonna heal. Improvements started happening the next week being with these guys. It healed at such a rapid rate that I couldn't be more grateful.
We were able to follow a certain pathway in healing his wounds, and it healed within a few weeks.
One thing about me is I am a paraplegic in a wheelchair. But some activities that I love doing is I love going to the gym. I love working out. I love getting my health in check. I love feeling the blood rush, the flow, the sweat. And I also love to cook. I love cooking. One thing about me is I love to cook. If there's one message I could say to the wound care team, is that you don't know how big of a role you play in all of our lives. All of us, we don't know what could happen the next day or what we could develop in the next month. But the fact that you guys are here and you guys are knowledgeable and you guys know what to do, us staying in Guam and us having you guys here, we are really blessed to have you guys here helping us out all the time.